Hello, good morning, everyone. I'm Dr. Gabriel Siquier, and I'm here for a webinar, CHAC Technology Cellbooster and Combination Treatment for very interesting two matters, for STRIAE and cellulite. We are going to wait just a few minutes to for the few participants that they are getting connected now. I'm in Mallorca and it's very strong stormy weather, so I hope the connection will not break. Otherwise, we will repeat sometime the webinar. If you have any question during the webinar, please do it on the chat, question and answers. We were gonna answer them during the webinar or at the end of the webinar. And when we are finished the webinar, there will be a small questionnaire for you, for the participants, to have a little bit of feedback. So don't disconnect immediately until we put these few questions. Okay, I see people is getting connected. And we are going to wait a few minutes because sometimes connection can be a little bit difficult. For the ones that you just joined, please question and answers. Make your questions during the webinar. We will answer them during the webinar or at the end. And there will be a small questionnaire at the end of this webinar. I'm going to give 3 minutes of courtesy. So at 10:05, we are going to start because I see people joining at this moment. So, see. Okay. So welcome, everyone. Good morning. I'm Dr. Gabriel Siquier. I'm founder and medical director of Dermato Clinics International. We have clinics in the Netherlands and Spain. I'm aesthetic physician. And today I'm going to talk about the CHAC technology, Cellbooster, and the combination treatment for STRIAE and cellulite. Cellbooster is a patented technology developed by Siquier and is a new era in injectable boosters because they're going to give you an effective delivery and long-lasting results. Let's go to see a small video about that. So we see that CHAC technology is formed in 3 steps. And what makes unique this technology is that we don't have any chemical binding agents. We're going to have a slow release of the active ingredients that we put into the specific formulation. And we have a unique complex of ingredients that we can use for specific treatments. So every formulation is with one specific indication. And is a class 3 medical device. What means class 3? That is safe, that is effective, and can be injected. So we have an injectable booster, a complex that will stay into the tissue with a half-life of 2 weeks. So that means that during these 2 weeks, the products, they will slowly release. So that will give us some advantages. We are going to have a faster result and a longer lasting result. We have to differentiate Cellbooster in the positioning from other products that we have in the market to understand. So we have some mesotherapy products that is native HA, not modified, with some complementing ingredients, vitamins, amino acids, etc. Sometimes to stabilize this product, they cross-link it and they add BDD or glycerol into the formulation to make it longer lasting. This will change a little bit the structure of the molecule and will win mechanical capacity, but will lose biological activity. Cellbooster is a stabilized complex mechanically by shear deformation and a strong pressure that will create a new complex that will last into the tissue for more than 2 weeks, allowing us to do a new protocol that will be more effective with faster results, but also better results. So it's a new generation of skin booster. It's medical device class 3. So we are allowed to inject this product. It's CE mark, so, and it's Swiss made. So you know that the technology in Switzerland is one of the best. We're going to have a complex made with vitamins, amino acids, and some specific minerals. And this technology is patented. It's patented check technology, mechanically stabilization of the hyaluronic acid with the active ingredients, vitamins, amino acids, and minerals. We have 4 products in our range. We have Lift, Glow, Hair, and Shape, and each of them with specific indications. Lift is for skin redensification and to improve skin tone and microcirculation. Today we are going to see the activity on the STRIAE. Cellbooster Glow for younger demographic, more indicated to reduce hyperpigmentation and to deeply hydrate the skin. Cellbooster Hair is for hair growth acceleration, scalp nourishment, hair loss, and also to fortify the hair follicles. So we're going to have a thicker, better, more healthy hair. And we can treat directly all types of non-cicatricial alopecia. Cellbooster Shape is a specific complex for local fat accumulation, like for example, the double chin, but also will help for liquid retention or lymphatic drainage. So today we are going to see the activity in cellulite. Let's go and start with the first one, that is Cellbooster Lift, and is coming in a package of 6 vials with 3 milliliters every vial. It's a product with yellowish coloration and will stimulate collagen production, microcirculation, but also cell nutrition. So it's capable to filling soft tissues, preventing oxidative stress, and providing deep hydration, thanks to the redensification of the skin that we are going to have thanks to the active ingredients and the hyaluronic acid that's into the formulation. So we can use it for an older demographic, but is specifically indicated for loss of skin tone and elasticity. So we can inject this product with a very simple protocol intradermally. And the formulation complex, we have 18 milligrams per vial with specific vitamins, riboflavin, that's the B2, vitamin C, the tocopherol, vitamin E, that is very necessary in patients above 40 years old, biotin, and then a specific blend of amino acids like arginine, glycine, lysine, proline, and valine. Let's go and see the key elements. The amino acids and the hyaluronic acid will help for skin redensification, microcirculation, and wrinkles filling. So it's going to give deep hydration, stimulate microcirculation, will improve the skin tone, the elasticity, and the smoothness of the skin, will stimulate collagen synthesis, because these amino acids, they are the essential ones that we need to conform the structure of the collagen, and will also support the tissue remodeling and the healing processes. The vitamins B2, C, E, and biotin will work as antioxidants, so they will protect the cells from the free radicals and the oxidative stress, preventing and helping to restore fine lines and superficial wrinkles. Let's gonna see, for example, some of the amino acids, like for the valine. Valine is one amino acid that is not naturally occurring in the body, but is vital for the general health of the skin. So that is essential amino acids that we need to consume with our diet because we are not able to produce them. This amino acid can help strengthen the building blocks that make up the skin, as well as locking in water for hydration. So it's an amino acid that will help us for the structure of the skin, but also for the hydration. Another amino acid, like the glycine, is working as inflammatory on cellular tissue and is an important component of the collagen itself. Glycine can also improve the skin health and reduce the appearance of wrinkles. It's a building block also of glutathione and an important antioxidant and repair protein that each one of our cells will need. So we have two very strong amino acid combination to give the fibroblast the capacity to produce more collagen and elastin. But today we are going to talk specifically about the stretch marks, STRIAE. It's also a general term referring to thin, narrow grooves or channels in a thin line or a band specifically. Several of them, they appear parallel and close to each other. So what are these STRIAE? What are these stretch marks? We have different types. We have STRIAE or singular stria, STRIAE distensae, that is a form of scarring on the skin with an off-color hue. And they are caused by the tearing of the dermis, which over time may diminish, but will not disappear completely. So at the end, a stretch mark is a dermal problem because we have this stretching, and the result of this rapid stretching of the skin associated with rapid growth or rapid weight changes will tear the dermis. Sometimes can be also influenced by hormonal changes, generally in puberty, pregnancy, bodybuilding, in hormone replacement therapy, and other things. We have different types of stretch marks. Let's gonna see them in detail. So we can have atrophic striae, we can have vergetures, stria dispensae, STRIAE cutis dispensae, linea atrophicae, linea albicante. So we see we have different types, and they can change from color, they can change from size, and they can change into evolution. So it's important to prevent them, but also to treat them as soon as possible. Because remember, the stretch marks is a form of scarring, and all of us know that the scars, they are difficult to treat. They can appear on the belly, but they can also appear on the breast, on the tits, on the hips, on the lower back, on the buttocks. Okay, why? Because on the areas where we have this tension, where we have this stretch, is where this is going to happen. Let's gonna see the signs. They generally begin as a reddish or purple lesions, which can appear anywhere on the body. And the most common places we are going to find is in the abdomen, especially near the navel, on the breast, on the upper arms, underarms, on the bites, on the back, on the thighs, both inner and outer, but also on the hips and on the buttocks. Over the time, they tend to atrophy and lose pigmentation, and the affected areas will, when we are touching them, they will appear empty. So we don't have a good dermal tissue there. So we're gonna find some hollowness there. So they occur in the dermis, and the tissue layer that helps the skin retains the shape. So we are not going to have a stretch mark as long as we have enough dermal support. So it's important to work on the densification of the tissue, on the biorestructuration, if we want to avoid the stretch marks. Remember that the area where they are occurring, they are on the dermis. So it's very important that when we are doing the treatment, we inject on the healthy skin that is around the stretch mark and not in the stretch mark itself. When other histological findings that we can find, so for example, on the STRIAE rubra, we are going to have lack of mast cells, we are going to have elastolysis, we are going to have structural changes in the collagen bundles. So that's why it's so important that we put into the formulation amino acids that can help to repair, and they are going to be building blocks for the collagen and the elastin, and we are going to have some dermal edema and perivascular lymphocytes. So it's also good that we have some products into the formulations that help to drain this dermal edema and to lower the inflammation. So that's important that the specific active ingredients of Cellbooster, that's why we did this specific formulation. The STRIAE alba will resemble scar tissue. They are a little bit more advanced, and we're going to have a loss of the skin appendages. We're going to have a densely packed collagens and bundles parallel to the skin surface. And remember always that this is going to happen into the dermis. Let's go and see the causes that we can have. Is caused by a stretching of the skin, but sometimes when we have an increase in cortisone, because the cortisone will waken the elastic fibers in the skin, this can happen more easily. So we have, for example, an excess of weight with cortisone that will help the skin to tear more easily. So why? Because we are gonna reduce the skin pliability, so it's gonna be more affected the dermis, preventing the fibroblasts from forming collagen and elastic fibers, and that's necessary to keep the rapidly growing skin tone. This can create a lack of supportive material, and when the skin is stretched, that will lead to the dermal and epidermal tearing, which can produce this specific type of scarring in the form of a stretch mark. So we see that is a dermal problem. The stretch marks, it's very common. They will appear in 70% of girls and 40% of men. And when we have these stretch marks, they will appear. We can see, for example, on bodybuilders, that will appear on the shoulders, in obese and overweight people. Remember that areas that they are storing fat that can appear faster. Abdomen and breast pregnant in women, also induced by hormonal changes. And when we are used for prolonged time oral or topical corticosteroids, for example, in patients with kidney transplant or patients that they are using anabolic steroids also. We have some syndromes like the Cushing syndrome or the Myford syndrome that they have adrenal cortical activity increased, and this excess of circulating cortisol that can also help to help the formation of the STRIAE. So let's gonna see about the STRIAE gravidarium. The STRIAE gravidarium pregnancy stretch marks is a specific form of scarring, and is happening in the abdominal area. Why? Because we have fat on this abdominal area. We're gonna sudden change weight, and we are gonna win volume also. So generally they appear in red, but then slowly they will change color to white. It's important to attack the STRIAE as soon as possible, but as we know, we cannot treat pregnant or breastfeeding female. So we need to, the moment that is finished, we can start immediately with the procedure. And if there is this STRIAE happening in the family, we can also prevent before pregnancy, preparing the skin, because remember, if we have a good then redensification of the skin, a good full dermis, the STRIAE will not appear. So what we are happening with the STRIAE gravidarium, we have an increase of relacin and estrogen combined with higher levels of cortisol. So the accumulation of mucopolysaccharides will increase the water absorption on the connective tissue, and then will make it prime for cleavage under mechanical stress. So in which specific areas we are working? Well, first of all, we are preventing cellular damage. We are acting on the inflammatory response, like we saw with the specific amino acids, and we are going to increase fibroblast production of collagen and elastin. That's why, because hyaluronic acid by itself, that is into the formulation of Cellbooster, will increase the activation of fibroblasts and keratinocytes that will increase the production of collagen, elastin, hyaluronic acid. So we are going to have a better cell regeneration. We are going to have a cell growth and cellular regeneration. So that's important to act in these specific cells, that we put the Cellbooster product into the healthy dermis. So we need to inject around the scar to activate, to try to break these collagen bundles that they have been formed after the tearing, and to have a better quality of the skin. Here we can see histologically the difference. We have a normal skin and the stretch mark skin, and we can see that there is decrease in the epidermal thickness. We are going to have flattening of the dermoepidermal junction, loose of the papillary ridge. So we're going to have a reduction of the amount of extracellular matrix components produced by the fibroblast. Remember that the hyaluronic acid is one of the main components of the extracellular matrix and has a very important structural activity on this extracellular matrix, because it's going to create links with the mucopolysaccharides, with the glycoproteins, with all the components that we have on the extracellular matrix, and will give a better structure, will thicken, help to thicken the dermis and to make it more stiff. So that will avoid this tearing of the dermis. Remember that when we are using these products, we can have allergy, so we can do a little allergy test. Generally, it's not happening, but in some patients that they are treated with immunodepressants, or they're not in a healthy state, we will not recommend to do this treatment. Which one is going to be the area of treatment? So the area where we have the STRIAE, we are going to do with dermal papula or retroinjection, and we're going to do one session every 2 weeks. Why these 2 weeks? Because the product is stabilized, so we're going to have it there in dermis, and generally we can have around 3 sessions In patients that they have an hormonal problem, or they are still growing or still bodybuilding, we can repeat the protocol 1 to 3 times a year to make healthier the skin. We can combine it with other treatments like energy-based device. And remember, after the treatment, important to avoid extreme temperatures, because hyaluronic acid is thermolabile, so we don't want to increase the temperature, saunas, hammam, and direct exposure to UV radiation. Sun or UV lamps has to be avoided after the treatment. Which sort of a STRIAE we can treat? So generally, when we don't have a palpable depression, when we have superficial white stretch marks or recent developing stretch marks that can be inflammatory red, we can start to treat them. When we have a palpable depression and we are having more than 1 centimeter wide, these stretch marks, they're already with an atrophic base, and the color will change to a pearl white base. So these are more indicated to treat with other techniques, like, for example, chemoablation. But we can still do the treatment in this area to prevent the formation of more. The problem is when they are so wide, more than 1 centimeter, and already with depression, with Cellbooster will not be able to regenerate completely. So it's important also, when we are managing our patients' expectations, to be clear about what. So we can do it for prevention. We can treat stage 1 and 2A with very good satisfactory results for our patients. But when we are going upper to other areas, can be preventive. So that is not happening anymore, but we need the combination with other treatments to avoid the area. Let's gonna see a little video of injection, and here we have the Presadato classification 2A. We can see, and you see I'm injecting on the healthy skin, these papulas, and the whole area. When we are treating body, sometimes we can have, okay, 3 milliliters will not be enough to cover the whole area. How many milliliters I can use? Well, I could recommend you maximum of 30 milliliters per session. So that's 10 vials of Cellbooster in total. I will not go above this area. You can see important that the treatment is intradermal. You can see that a little drop is getting out when I take out the needle because the pressure of the skin. We can simply treat slowly the whole area. You need to treat back, and even I have to find the healthy skin, and I inject around these white stretch marks. We can see with very nice result. This is before and after. We have redensification of the skin. This is after completing the protocol. We can see that the structure of the skin has improved a lot, but these, we can see these ones that they were a little bit thicker and a little bit deeper, they improved the appearance aesthetically, but they didn't completely disappear, even though the patient is very much satisfied. Okay, let's gonna see the program. Intensive course, 3 treatments bi-weekly, and in that cases that the patient is growing or still having some changes, we can do 1 treatment a month for maintenance or for prevention. Okay, remember, if you have any question, do it on question and answers, and I'm gonna answer all of them at the end of the webinar. Let's gonna talk now about Cellbooster SHAPE. Cellbooster SHAPE is designed for local fat reduction and for reduced water retention. Will improve also microcirculation, so it's ideal for some areas like the double chin, we have excess of edema on the malar fat pad, but thanks to this reduction of water retention and this improvement of the lymphatic drainage, we have the ability to treat one of water retention problems, that is cellulitis. It's coming in a package of 6 vials with 3 milliliter every vial. And the indications, I already explained it. What is into the formulation is a synergic effect between L-carnitine and vitamin C, also with a concentration of hyaluronic acid of 18 milligrams. The L-carnitine reduces the local fat accumulation, water retention, and puffiness. Why? Because it's doing the decomposition of the long chain of fatty acids with acetyl-CoA release, and this will normalize the metabolic process, will stabilize cellular membranes and skin salt-water balance. That's why it has this capacity of improving the water retention, will stimulate and fasten reparative processes, and will mobilize fat from deposits. It has a drain effect and will reduce liquid congestion. We're going to see now specifically how this works. The vitamin C is also considered like a fat-burning workout booster. The studies have shown that individuals with adequate vitamin C status will oxidize to a 30% more fat during moderate exercise. So it's like a fat burning workout. It's more efficient when the vitamin C level is high and will complement the activity of the L-carnitine. And remember that it's not the vitamin C or the L-carnitine. What it does, the activity is the complex. So that's very important because we have this powerful, strong release of the components, sequential release. So it's like if every day we are activating the cells with the release of L-carnitine and vitamin C. And so we are helping to moderate the edema. We are helping with the antioxidant activity of the vitamin C. And we are helping to break down the fatty acids with the L-carnitine. The carnitine will transport the long chain of acyl groups from fatty acids into the mitochondrial matrix, so they can be broken down through beta oxidation to acetyl-CoA. And this acetyl-CoA to obtain will be usable energy via the Krebs cycle. So the mechanism of action is not like any other fat dissolvers that we can find in the market, like deoxycholate or other things that they break the cellular membrane and they create a cellular apoptosis, and that creates an inflammation. So this is not going to happen. This is a very safe product. You can inject it close to the muscle. You can inject it more superficial in the skin, and you will not have this inflammation or necrosis, because what it's doing is to transport this fat into the mitochondria and convert it into energy. So we'll have a long depletion of this excess of fat, and the vitamin C will help also to the activity of that. Let's gonna see now the cellulite treatments. Now we understood the activity of this product, and is the only pathology which induces thermal changes is the cellulitis. So we can see also that we are talking about a dermal problem. Cellulitis again is a dermal problem, so we need to inject part of this product in the dermis when we are treating cellulitis. We can have different stages of cellulitis. Here we see body mass index under 20, and they have this shark appearance, like a mouth shark, or the allet, I don't know, of the shark forms. So that is very clear when we are doing the echography. When we have this presence of that, that means that we are dealing with cellulite, even though the clinical diagnosis is very, very easy. How we can prevent cellulitis? Oh, if we have a goodwill, orthodox, political correct treatment, so we do a sport, a calibrated diet, we do massage, we do lymphatic drainage, we can have prevent or have less cellulitis. But the problem is when the cellulitis is installed, we need to find a way to solve it, because what is actually happening on the cellulitis? Well, we have different types of cellulitis. We can have no cellulitis on the first. When we see that start this accumulation of liquid and fat, we could do phosphatidylcholine plus preventive cell booster shape. Then when we start to have these indentations, we can do phosphatidylcholine plus therapeutic cell booster shape. And when these indentations, they are very big, we need to do hyaluronidase plus phosphatidylcholine and cell booster shape, or using other energy-based device to try to tear the indentation. This is fibrotic cellulitis, so we need to do the treatment in 2 phases. The first phase will be to undo the fibrosis. The fibrosis, we can undo it with hyaluronidase or energy-based device, like, for example, Celfina. Then we are going to undo the cellulitis, because we have 2 different problems in that sort of skin. One is fibrosis, the other one is cellulitis. And to undo the cellulitis, we need to use the cell booster shape. What is happening? The long-term edema creates a blood vessel strangulation, and that will create some inflammation. And long-term maintained inflammation will stimulate the deep myofibroblasts, mainly responsible of the dermofibrosis. So we're going to have a combination of circulatory problem, edema, and fibrotic. So reducing edema will reduce the long-term inflammation, so we will not allow the formation of cellulitis. So here we can see that these myofibroblasts, they create this fibrotic tissue, and is like an anchor point that we really need to destroy surgically. We can do a cut there with energy-based device, and we need to drain this lymphatic edema. So where we need to inject is a little bit deeper. We need to pinch the skin and inject where the edema is created. What we can use against the fibrosis, against the other problem, we can use corticoids, but not in cellulitis. We can do subcision with adrenaline, lidocaine, plus corticoids and hyaluronidase. And the hyaluronic acid is actually considered as a marker for fibrotic process, and is one of the main actors of the skin matrix regeneration after injury. The hyaluronidase shows the possibility to block many fibrotic processes. We see it, for example, when we have a complication after filler and then we have a scar, we can inject hyaluronidase also to help. But remember that hyaluronidase is a protein, so we have a risk of allergy. So when we are injecting high doses of hyaluronidase, we need to do an allergy test every time. So what we normally do is we inject 6 to 15 units. We wait around 20-30 minutes. If there is redness or there is itching, that means that this patient is allergic. So we cannot proceed with this injectable procedure. So we need to use energy-based device 1. Here we can see thermal reaction after 20 minutes. Remember, every time you're using high doses of hyaluronidase for therapeutic processes, you must perform an allergy test. Where we are going to inject this hyaluronidase. So exactly on the indentation deep with 10-12 millimeter deep, and we are going to use around 1,500 units per leg. It's better to inject linear retrograde, and we can use around 10 points. So you dissolve these 1,500 units into 10 milliliter, and the first week you are going to do it on the anterolateral area, and the second week posterior internal area. 2 session max, signs the risk of local allergy. So we're going to do these 2 sessions, and that will be enough. The treatment of cellulitis itself, we can do it with intradermal injections, but my recommendation, and says Cellbooster is a class 3 medical device, so this means that it's legal for injection and you have enough space in the vial to mix it with Lido. So I will do 1 session bi-weekly, 3 to 6 sessions, it depending on the necessities on the stage that we are. Which ones are the complications that we can have? Ecchymosis is frequent because we're going to inject deep. They will last for around 8 days, and possibility of allergy. There's not actually case detected, but if you have a patient that is allergic to a lot of things and you are afraid, just do little allergy test. No other side effect to be waited. These products that they are non-toxic and they're working to cellular level. If you are keeping this safety protocol that I told you, maximum 10 vials, then you're not going to have any complication. So the general graft of the treatment will be, we do allergy test with hyaluronidase. Then the other week we do Cellbooster SHAPE, and then we continue the next weeks with Cellbooster Shapes bi-weekly. Remember, we can use it superficial in some cases, but the best is to inject deep where there are the fat excess and the edema, because sometimes it's very difficult to differentiate if it's fat excess or if it's edema, because most of the time it's both. But what I do, I normally pinch the skin. I have 1 centimeter of skin there, and I inject linear retrograde 0.1, 0.2 milliliters per point. Here we can see a little video how I normally perform. In that case, is in the belly area, but doesn't matter. We can apply on a cellulite area. Normally, I do a marking is 1.5 to 2 square centimeters on the selected area of treatment, and then with a needle of 13 millimeters, I pinch the skin, have 1.5 2 centimeters. I inject 1.5, 0.1, 0.2 milliliters per point. Remember that I inject while I'm pinching to keep on this area the Cellbooster shape. If you wish to use a cannula, that's also possible in some patients that they are bleeding a lot, or they are in treatment with anticoagulants and you don't want to make a mess on the injection area. You can also use a cannula, in that case 25 G cannula, but actually my practice is faster, it's not painful because I'm using very thin needle, like an invisible needle or 33G needle. So then the bruising is you can have a small ecchymosis, but the bruising is not that much. Okay, you can also use in men. And you can select other areas of treatment, like can be the love handles. So you see that Cellbooster shape really is good for body in both sets, and you don't have this worry of edema and inflammation than you can have with other products like the oxycolate. Here we can see one of results. This is combined with training. We remember that with vitamin C, we have a faster degradation of fat. So then combined with training, so these specific areas that is difficult to lose fat, we can accelerate the process. The program, I remember, 3 treatments with 2-3 weeks interval. Cellulites, unfortunately, is chronic, so we will recommend 1 treatment per month or one treatment every 2 months at least to maintain the results, because otherwise we're gonna, if the cellulites progresses, we're going to have again the indentations, again the fibrotic tissue, and to repeat hyaluronidase treatment for that, we can have a high risk of allergy with this level of units that we are going to use. So this was my presentation for today. Let's gonna have some time for questions. You can follow us on Swiss Pro and Ameto Clinics International. And remember that at the very end, we're going to have a small questionnaire. So let's go to see question and answers. And this from Diana Vulcanescu. I would like to know the needle size you use, how many G and millimeter. Okay, so I normally use invisible needle for DSK, that is 9 millimeter, but you can use a 33G needle, 12 or 13 millimeter. And then Ebru Yuseturk is asking, if the underlying reason of ongoing sports are not still present, then can we assume that the results are permanent, generally recurring sessions are not needed? If I think your question is regarding the STRIAE, yeah, once you solve the problem and the person is not gonna grow or will not make changes of weight or that, but remember that people that they have a lot of STRIAE, the stretching in some areas can always tear the dermis. So in some patients that they have a lot or they are going through hormonal changes and things, you could do some sessions to prevent once we treat the area, because the skin, thanks this dermal tearing, will always get a little bit affected. So I could recommend to do 2 or 3 sessions a year to try to maintain and to prevent that appears again, the STRIAE. And say, can you inject with a vital injector with a gun? Yes, definitely. You can inject it. It's no problem for that if you feel more comfortable. But remember that the importance is to inject into the dermis for the STRIAE, and where is the fat accumulation or the edema, the water retention into the cellulite. So the plane of injection is very important when we are treating this affection. After the injection, do we need to apply compression? No. We don't need to apply compression. You can, if it's bleeding, you can apply a little bit of compression, but the volume you are injecting and the product will distribute in the area of injection. You can do simply a little bit of pressure, but you don't need to apply compression like with other techniques, because the product will stay there for more than 2 weeks and will release and will balance the water retention, the fat, and will do redensification of the dermis. Then Diana Vulcanescu asks again, how many milliliters can be used in wash sessions or per area? So I told you maximum of 30 milliliters, so that's 10 vials, and I will use 1 close hand like per vial per area. So 1 close hand for 3 milliliters when we are applying on the body. So in the abdomen area, you could use 2 or 4 vials in total. Then Saliha Yasharov says, how many products for the tear throw per side? Cellbooster LIFT. On the tear throw are for tear, so you do little papulas around the area, so 0.05 milliliters per point. Sana Marie say, how about the lower abdomen after pregnancy? How this is the problem area? Yes, you can apply it if you have excess, and you can combine them, because sometimes you have a little bit of excess of fat and a little bit of STRIAE, so you can inject Cellbooster LIFT intradermally and Cellbooster SHAPE into the subcutaneous tissue. Then CDCA has some aspect. Concerning low, can you inject under the eye? Yeah, so I will do little drops, maximum 0.2, 0.5 milliliters maximum for this area. Okay. So remember, I'm sorry because I don't know if there was a lot of problem with the sound because it was terribly storming here. But if you have any question, this webinar has been recorded. So soon you will have access for that. And now I answered all the questions. I will let my colleagues from Suicel to pass you for the questionnaire. It was a pleasure for me and hope to meet you soon, webinar or live in one of the congresses or lectures I'm giving. Thank you very much. Goodbye.